Major funding for these programs is provided by grants from HSH Nordbank and First American Title Insurance Company of New York, Perfect Building Maintenance, SJP Properties, Murray Hill Properties, Bank of America, Greenberg Traurig, Allied Partners. Additional funding is provided by grants from Arbor Realty Trust and Terry's Investment Partners, Athena Group, BRT Realty Trust, BERDON LLP, CB Richard Ellis, City Habitats, City Investment Fund, Cushman & Wakefield, Eastern Consolidated, ESSEX Capital Partners, Herbert J. Sims & Company, Herrick Feinstein LLP, Helmsley Spear, Jackson Development Group, James D. Kuhn Real Estate Institute at Syracuse University, Kilroy Metal Products, Massey Knackle Realty Services, M&T Bank, Madison Realty Capital, Marcus and Millichap, Meriden Capital Group, McSam Hotel Group, Newmark Knight Frank, Moynihan Organization, Muss Development, Palin Enterprises, Rosenthal and Rosenthal, Signature Bank, Sidney Fettner Associates, Sheldrake Organization, Stonehenge Partners, Studley, Triangle Services, WITKOFF Group, Extreme Contracting and Deconstruction.
My name is Michael Stoller, host of the Stoller Report, Real Estate Trends in the Tri-State Region. What is the biggest industry in the Tri-State Region? Everybody thinks it's, commerce, other thing. The biggest industry, the most important industry is the healthcare industry. And to bring to perspective of what's happening in the healthcare industry, I brought today the mavens, the 850-pound gorillas of the healthcare system. Beginning from over here, the largest employer in the city of New York, next to the city of New York, is Dr. Herbert Pardes, President and CEO of the New York Presbyterian System. Over there, we brought him in. He was allowed to come through without permits from Nassau County. Michael Dowling, President and CEO of the North Shore LIJ Healthcare System. From Greenwich Village, we brought in Henry Amoruso, President and CEO of the St. Vincent's Catholic Medical Center. And last but not least, from the Upper East Side, but north of 96th Street, we have Dr. Kenneth Davis, the President and CEO of the Mount Sinai Medical Center. So we were saying prior to the show, why is healthcare so important? I know it's important, but I want you to tell my audience why healthcare is so important in New York and
Healthcare is important everywhere. One of the most exciting things that's happened in the last 50 to 100 years is the increased longevity of people. People live longer. People for longer times have healthier lives. They're working later. They're enjoying things. What more important thing could you offer a person than the ability to live longer, to have all kinds of treatments that can solve a large number of diseases and keep you functional, and keep you living, loving, and working and doing things.
So living longer and taking care of this is requiring people like Ken, Henry, and Michael and you to build all over the city of New York and longer in Nassau County. I mean, we were talking part of the show, Ken, you're involved with 2 projects which are close to 700,000 square feet.
We just finished building an ambulatory care building. That'll be about 170,000 square feet. It's opening up in a month or so. And then we will begin a big project of another 500,000 square feet to add both a research and clinical building that will be particularly focused on cancer. I might say, why are we doing all that building? Why is it important right now? The demand is there from people for care, but it's also the demand of science. New York is a hard place to build in. And for Herb and I, particularly where we have large medical schools that we have to worry about as well, it's important that we have enough lab space to do the science that's really on the revolution of medicine today and will provide the next treatments for tomorrow.
But you were also saying prior to the show, in addition to having the lab space, you need the revenue flow from the drugs or the
Well,
royalties.
first of all, you need the revenue flow, since we are all clinical operations, you need the clinical revenue flow that matches the expenses of healthcare. And New York is arguably the most impossible setting in which to do healthcare financially of anything in the country. It is extremely formidable. On the other hand, New Yorkers like to have the best of everything. Why shouldn't they have the best of healthcare as well?
New York, when we last looked, was 49th out of 50th in its hospitals margins. 49th out of 50 states.
So if I had a hospital in Phoenix or I had a hospital in Pittsburgh, I'm going to make more money.
The margin for the University of Pittsburgh Medical Center last year was about $600 million.
And the margin?
The margin for all the hospitals in New York collectively was close to zero.
Right. It's important to keep in mind, we talk about margins. None of us are here to make profit. We're not a for-profit business. We're all not-for-profit hospitals. Those margins go back into things like physical plant, recruiting new doctors, doing science, and even keeping the floors clean.
Right. But you're right now, you're talking about a major new physical plant.
New York, in addition to having the thin margins on the operational side, is probably one of the most capital-starved healthcare systems in the country, if not the most capital-starved healthcare system in the country, for a whole host of reasons tied to reimbursement and just legacy of healthcare policy. At St. Vincent's, it's important for us, in order to be the resource we think we are to the community, it is to build a new hospital. It's a complete replacement hospital. Only way that can be done in an environment such as this is literally to leverage your balance sheet, to sell existing assets, to sell property. That's always difficult for a community, particularly in a community like Greenwich Village, but there is no other way. There's just simply no other option because there is an inadequate state formula, there's an inadequate reimbursement formula, there's an inadequate policy formula, if you will, to put capital back into facilities.
I think you have to look at the other side of it also, Henry. The construction costs in this city are probably higher than almost any place in the
No
country.
question about it. And as we're looking presently at what our cost per square foot is going to be, naturally we can benchmark it around other large building projects in the country. We're not picking rural areas. We're picking areas in cities. And we're
But
seeing as
Henry,
much
even
as
if we went to
30%.
Jersey, the costs are much less, we said.
I was talking to perhaps one of the most successful hospital systems in New Jersey who has a strong margin, is building a full replacement hospital in South Jersey, and their costs per square foot are probably 30 to 40% less than ours here in Manhattan.
But I don't think we would like to be seen as simply trying to complain about something. I love being in New York. I think it's a great city, and we love to serve people and make them better.
But part of serving...
What we want is the understanding and support of the political and philanthropic communities.
But let's get to this. Michael, your building, I mean,
Right.
you have 39 hospitals or something?
No, we got about 39,000 employees.
39,000 employees.
In fact, that we're also a large player in New York City. I mean, we're the biggest player in Queens, in New York City, because remember, Long Island Jewish is in Queens, and we got Staten Island in New York City. So it's not just a
So they allowed you to come over the border? I mean, I know you were...
Yeah, I get special privilege.
Yeah,
when
special
these two
privileges,
guys. But we communicate all of the time. But one of the things that's important to remember here is that despite a lot of the difficulties that we all have and that we all talk about, that there is extraordinary good things happening. I mean, on a day-to-day basis, it's remarkable what happens in these hospitals. We're the safety net places for the majority of people where they get health care. And there have been attempts to demonize hospitals, which is very, very, very inappropriate, and demonize the people that work there. We have terrific people who work in the hospitals that do wonderful things. We've got great physicians. We've got terrific science. But you've got to keep moving forward. So in our situation, we are in the midst of a massive building program, because many of our hospitals were built in the 1950s, the 1940s, the 1930s, some development done in the 1970s. And you've got to bring the facilities into the modern era and to meet the expectations of the patients of the 21st century.
But to link it, there's a business side to what we do, but I think even more important is the mission. And in these hospitals, some of the major innovations in healthcare are happening. New devices, ways of doing surgery with much less invasion. We have the largest transplant center in the United States. You have outstanding doctors. I think people who come out of the health profession get great pleasure out of being able to be helpful to people. And the phenomenon that technology, et cetera, and then being able to help people through disease is something that makes us feel very good. All we want is the support and collaboration of the other elements of society.
But how do you operate? I mean, you're building a new hospital, you're building 2 new buildings, you're through a major expansion, you constantly build all the time on all the sides. How do you do this, I mean, with limited available money, government support, bottom margins which are negligible? I mean,
I think one of the things that is not fully recognized is that despite some criticism to the contrary by some people, I mean, people are very, very creative. You have to be continuously creative. You gotta promote philanthropy as much as you possibly can, and New York is one of the greatest places where people give and give to worthy causes, and that's obviously a development that has to continue. So philanthropy is a big part of this. You obviously have got to make your operations as efficient as you possibly can, which we continue to try to do despite low margins. You try to make sure that you can come up with enough cash to put in for future development. And then obviously you've got to go to the debt markets. I mean, we go to the debt market every 2 years or so. But I've got to make the operations functional so that I can obviously meet the obligations of that debt when it comes forward. But you can't stay still.
Underscore the philanthropy. This is the most generous city in the world. And it's not only us who know it. It's our colleagues who run medical centers in Minnesota, Hopkins, Cleveland Clinic. They're all here also advertising and trying to ask people for money to help them. I think New Yorkers should have a degree of chauvinism and want to see good facilities there. If you get sick in the middle of the night, you're coming to one of these places. You're not going out to some other part of the country.
The success of the new St. Vincent's will in large part be based upon philanthropy. Notwithstanding what debt we may need to carry, the sale of assets, it really will be philanthropy that makes the new hospital a possibility. And we are fortunate, and I agree, this city has been, and the people in the city have been remarkably receptive to the idea of contributing in charity for healthcare. It is a very mission-oriented business, and they're very generous people, very much tied to the mission of these institutions.
What about, you know, we're bringing all these doctors in. Where are we putting them? Where are they living? I mean, this is
one of the most tough challenges.
That's one of the biggest challenge. I mean,
many of us have to build our own housing facilities.
I mean, you're opening up one on First Avenue and Second Street.
We have housing, a lot of housing for our residents and fellows and students. Obviously, the real estate market in the area, when you bring in physicians from outside the area, the real estate prices in the past couple of years have been somewhat of a deterrent to some people, because when you come from a North Carolina, South Carolina, you come to New York. Now, that's obviously changing a little bit, but still people, it's amazing. People want to come to New York. It's the epicenter of innovation.
And you got to give credit to some people who've done a great job. The last 2 mayors of this city have turned this city around. Imagine New York being one of the lowest crime centers in the country. The excitement of New York is unbeatable. So as Mike was saying, we have people we're recruiting from all over the country. The problem is the resources, and usually housing is at the top of the list. That's where the philanthropy comes in. The more we get help from other people with the financial resources, the better we'll be able to build facilities.
Philanthropy is the increment that makes it possible for us to recruit these people from really all over the world.
But you know, in addition, you're building a new dormitory, a new facility on 72nd Street and First. You sold because of financial, when you needed it, and you're trying to expand your property on 105th, the
we sold 2 apartments over the last few years
over the last couple of years. But you need that, you know, you're building this new research facility. Why don't you tell me a little bit about that, the 500,000 square foot research facility?
Well, science is driven, it turns out, by square feet of research space, square feet of lab space. If you do a graph of those medical centers that receive the largest amount of federal grants, it's like a straight line with the amount of square footage of laboratory space they have. And what is sad about New York is that we have somewhat been delayed in building all that space and keeping up. Our competitors around the country, Penn, Hopkins, some of the places in California, particularly Pittsburgh, they're able to build at a much lower cost. And as a consequence, they become a magnet for bringing in scientists and for bringing in grant dollars. Now, it's critical to New York that we not lose that edge. And we have to understand that unless we address the issues of, for young faculty, schools and how to afford them, real estate, how to live, and how to build these laboratories, we're going to lose the very best intellectual talent, which then loses, you know, the future treatments and therapeutics, and as I said at the beginning, it also loses the intellectual property that becomes an important royalty stream for a lot of our institutions.
One of the other things about New York that has to be remembered is that New York has a tremendous amount of social need. We have a large number of people who are in financially destitute situations. One of the things that I like is the fact that when these institutions are made strong and are able to deliver care, we're delivering a tremendous amount of care to people who have little or no means whatsoever.
Right, we were talking part of the show.
This is very critical.
You brought up.
Yeah.
What percentage?
We are at New York Presbyterian, between Medicaid and Medicare, is approximately 60% of our activity. And on each of those streams, Medicaid and Medicare, we lose money.
And that doesn't count the amount of unreimbursed and underinsured, the pure charity care that's given out, which in some New York institutions reaches potentially 10% of their operating budget.
Let me give you some examples. At Mount Sinai, where we live in the juxtaposition of the poorest zip codes in America and the richest zip codes in America, we have a fault line of those communities, those very different communities, that runs right through our emergency room. And in our emergency room, you see side by side the richest and poorest Americans. At Mount Sinai, like at my colleagues' hospitals, we are committed to the notion that everyone is treated equally. Everyone gets the same quality of care, rich or poor. The consequence is that when somebody comes to our emergency room, it costs us about $400 and something a visit. We receive in Medicaid about $100 a visit.
By the way, about the same amount that we received, what, 15 years ago?
15 years ago. At Mount Sinai, to talk about undercompensated or uncompensated care, we have an $80 million loss in undercompensated or uncompensated care to people who just can't afford the quality of care we'd like to give. We take that as a given. It's what we start when we start to build the budget every year. It's what we believe in. It's because it's the nature of the institution.
So let me show you an example of what political and other people in the society can do to help us. Because there are things that you can do which I don't think will cost a lot and yet help everybody. For example, there is a real push now to get a malpractice relief bill through. It's not going to cost anything in the way of health care. It takes care of some redundant payments. We're hoping that the political leadership will see fit to bring that through. We will take some of the cost away from these hospitals, enable them to do more in terms of recruiting, building facilities, building technology. We sit with 9 million square feet of space at New York Presbyterian. We've got to be renovating all the time. Nobody is going to be pleased to come into antiquated facilities that are creaking and basically unsafe. We've got to make them safe.
Which is what Michael was saying before. I mean, you have these facilities that were built in 1947, which are antiquated. Right. The operating rooms are different sizes. They're not working.
Yeah, so we're totally rehabbing old facilities, and we're building completely new. At LIJ, for example, we're basically building a new hospital at Long Island Jewish. And the Children's Hospital, we're going to be adding a whole new pavilion to it. The psychiatric hospital we have has to be completely rebuilt. And that goes way, way back to the 1940s and 1950s. The expectations of people today is much different than it was in the 1940s and 1950s. And the requirements that we're all under for quality requirements and patient service requirements and everything else requires that you obviously have to have your facilities that are up to snuff. And that's what we're all trying to do. And what's amazing in a bad environment, that we're all trying to be so innovative to figure out how to do this in a very, very difficult environment in New York, which is, by the way, the envy of most of the United States. The science that goes on here in New York hospitals is the envy of the world. New York should be proud of this. The leadership should be proud at the state level and the city level. They should be saying, hooray, this is absolutely terrific. And everybody complains about emergency rooms being crowded. We all have crowded emergency rooms. Well, unless you come up with some alternative ways and some alternative places for people to go, there's no alternative.
What happened a number of years ago? All these freestanding clinics, all of these tertiary clinics around the city, you know, that all these hospitals were opening up these facilities.
Many of them fell to the same economic pressures that we're confronted with. Reimbursement remains a very difficult issue. Reimbursement, despite all we read and hear, is not appropriately moving with the cost of health care. The expense side of health care is outpacing reimbursement by a significant margin.
But we still, the hospitals in this city, amongst this group
All
here,
of us.
do a tremendous amount of ambulatory care. We did 1.8 million ambulatory care visits last year,
Amazing.
and about 210,000 emergency room visits. And you lose money on all the ambulatory care and all the emergency room care.
And in some cases, and I would imagine, get no reimbursement at all, not just lose money on a margin of reimbursement, but you actually get no repayment at all in some cases.
How difficult is it to do recruitment today?
For new physicians,
For new physicians, for top-notch researchers. Ken's mentioned before you're building a new cancer center.
package-
You just opened up a new one. I mean,
And we're
It's
also
huge.
billing.
Hugely, the package is huge.
It's resource dependent.
Yeah.
People want to come to New York. New York is a great place to enjoy, to live. It's very expensive. We talked about housing. That's where you need the margins. Ken made a very important point before. We're not looking for profits. We're looking for money with which we can bring best doctors, nurses, staff, et cetera, facilities here.
But when you recruit, I mean, we're just completing a 40 million new research tower next to North Shore. But when you recruit, you know, everybody looks at the salary you pay, but it's not. It's the facilities, it's the equipment,
Right.
it's the housing,
wait
it's
a
the
second.
whole
Isn't there
package.
something called NIH? I think you went with NIH. What about the government? What about
The
these?
NIH gives you money for research, but it never quite pays the full freight of research.
You
But
lose
just to
about
go back for a
10%
moment,
on every grant.
I would say in the last 5 to 10 years at New York Presbyterian, our new leaders of the departments and so have come from every sector of the country, California, Texas, Massachusetts. We can recruit to this city.
But isn't it also true that people from around the world want to come to New York City? Because it
absolutely.
has the greatest health care. I mean, you know, you can go on an airplane and you'll have these. I happen to just come back from a trip and I see Baylor advertising, UPMC, you know, all these hospitals. They're trying to take away from the greatest city.
Amen.
And this is the situation because you have the greatest brain power here. You have more medical schools. You have the highest situation.
Other centers are trying to come in to take patients away. They're competing with us for international patients, and they're competing with us for philanthropy. So when you see advertisements from
That's right.
Pittsburgh, the Cleveland Clinic, and many other institutions, they're here, they're fundraising, they're trying to draw other people away.
And that's
fair game in an open society.
But from
What
the city
we've
of
got
New
to do
York's
is have
from the
strong enough
city's
programs to respond to the needs of New
But
York.
from the city's perspective and the city of New York's perspective, we not only provide a social value and a human value in terms of the care, but this is a huge economic engine for New York.
What about the hospitals that closed because of the report last year?
the Burger Commission.
Okay, the Burger Commission. I mean, many of these hospitals didn't need to be open. Would you agree that the Burger Commission was partially correct?
And partially incorrect.
And partially
You
incorrect.
heard me say partially. I didn't say totally correct.
Partially correct and partially incorrect. I mean,
Our
but I-
our
Go ahead.
hospital association supported the Burger
Burger
Commission.
Commission.
We said it should be done. They should prune down.
in fact, the Hospital Association was one of the initiators of the Burger Commission.
But it has placed an increased pressure on some area emergency rooms because the rest of it hasn't been thought out and implemented just yet. I mean, there's got to be, whether it's Burger 2, there's got to be some following process that talks about
let's look,
the
Henry.
reliance on
Take
it.
your own situation. St. Vincent's closed the other hospital, so that was one emergency room on the west side. So that portion over there,
We
we've
now have a
lost
catchment area that covers from the Battery Tribeca up to Clinton, the Times Square area, and we're the only trauma designated center, Trauma 1 designated center on that side of Manhattan. It's a huge catchment area that's been assigned to a hospital whose physical structures are very tested. One of the reasons we need the new hospital is to respond from a healthcare policy point of view to access and to needs on the west side of Manhattan.
Then how do systems, you know, such as, not systems, hospitals such as Maimonides or Montefiore, who are freestanding institutions like you, survive in this world?
What do you mean by freestanding?
Well, Montefiore is a large system.
Large-
Yeah,
They're the
they have
dominant.
multiple hospitals.
They're the dominant system in Bronx.
in the Bronx.
What about
And they're
Maimonides?
associated with Einstein, so they really are very large and robust systems.
Montefiore and Maimonides are good hospitals, doing a good job. I'm not sure what you.
No,
why you say that the
I'm
problem
trying
is.
to, you know, everybody's competing. Unfortunately, I remember, I'm getting myself a little older. I remembered, you know, when it was the time that lawyers didn't advertise, accountants didn't advertise, and hospitals didn't advertise. It was a different world. Now you can, you know, you have great urologists, you have great heart surgeons, you have great cancer centers, and I mean, this is the advertisements. You know, it's a different world. How do hospitals survive?
What really makes it a different world is the education of the patient. Patients go to the internet and they want to find the best doctors. They do their homework and they increasingly find out that there's a difference between doctors who write the books and doctors who read the books. And the consequence for New York is that systems increasingly have to come together around medical schools so that there can be a core medical school at the center with the people who create the knowledge which give you the cutting edge of medicine. And those hospitals that are kind of outside those systems have a challenge. That's why you'll probably see increasingly hospitals coming together so that they can all compete.
Yeah, you asked the question, how do some hospitals survive? And I would say the survival mechanisms are many. One is that you watch the nature of the reimbursement streams for a hospital. A hospital which has an overwhelming amount of Medicaid is going to have a very tough challenge to survive.
I mean, there's an affiliation or some involvement with Memorial Sloan with you. They are a separate hospital, aren't they?
They're a separate hospital. They're not affiliated. We have some interactive collaborations
They're
with
a
them.
unique hospital that does just one thing.
I don't get the point.
They do one thing.
They do one thing.
You know, they're not
Do
a
they make money?
multi-purpose hospital.
Are they profitable?
I don't think they make big profits. One of the things they have been able to do rather effectively, I think, is display themselves around the country as one of the answers to cancer in the country.
But
And
I'd
that's been a very
say
effective
you have
philanthropy.
important cancer programs.
Absolutely.
You have
Philanthropy is
everyone
very-
over here. I mean,
all we're saying is that their single focus on cancer gives them a certain advantage. And you got to also look at what's the stream of patients. How many Medicaid patients do they have? I'm telling you, that's an important barometer
I also
for any
think that
hospital.
single-focus hospitals, not to pick on Memorial Sloan Kettering, which is a great hospital, but single-focus hospitals have some disadvantages too. There was a time that there was hospitals for leprosy, hospitals for cancer, separate hospitals for psychiatric disease. A lot of that is tuberculosis, because they were deemed incurable and hopeless. As cancer, as an example, becomes a chronic disease and a curable disease, it's a disease that can often be best served in a general hospital, where people who have comorbidities can also get them taken care of.
Ken is absolutely right. You're seeing the story of healthcare today is a much older people. When I was an intern coming to a hospital, people were 40, 50, and 60. Today, it's not unusual. They're 80, 90, and 100.
Yes.
They have multiple diseases. Sometimes a disorder coming into a single focus hospital might look like one thing and really be another. You want to make sure you got
that's why you want to have
comprehensive group.
everything in full facility.
That's why you want to be a full service.
Right. I mean,
one of
even
the
though you're
things-
freestanding, you have a cancer center.
One of the things you might see for a system such as St. Vincent's, and I think when you're referring to freestanding, we're not part of a larger system, is I think you're going to see an era of some affiliations, some partnerships, and some collaboration, which is ultimately going to be very good for healthcare in New York.
For me to talk about healthcare expansion, philanthropy, and everything would probably take me 3 to 4 hours.
2 days.
But,
2
days. But I'd like to say in this primer, and we will have another show about this, and hopefully all of you will come back. I'd like to thank Dr. Herb Pardis, Michael Dowling, Henry Amoruso, and Dr. Kenneth Davis for being here. Next week, we leave the healthcare mood and we go to what's happening in downtown Brooklyn. See you next week.
Major funding for these programs is provided by grants from HSH Nordbank and First American Title Insurance Company of New York, Perfect Building Maintenance, SJP Properties, Murray Hill Properties, Bank of America, Greenberg Traurig, Allied Partners. Additional funding is provided by grants from Arbor Realty Trust and Terry's Investment Partners, Athena Group, BRT Realty Trust, BERDON LLP, C.B. Richard Ellis, City Habitats, City Investment Fund, Cushman & Wakefield, Eastern Consolidated, Essex Capital Partners, Herbert J. Sims & Company, Herrick Feinstein LLP, Helmsley Spear, Jackson Development Group, James D. Kuhn Real Estate Institute at Syracuse University, Kilroy Metal Products, Massey Knackle Realty Services, M&T Bank, Madison Realty Capital, Marcus and Millichap, Meriden Capital Group, McSam Hotel Group, Newmark Knight Frank, Moynihan Organization, Muss Development, Palin Enterprises, Rosenthal and Rosenthal, Signature Bank, Sidney Fettner Associates, Sheldrake Organization, Stonehenge Partners, Studley, Triangle Services, WITKOFF Group, Extreme Contracting and Deconstruction.